Why do some Parkinson's patients not develop tremors? Imagine a person diagnosed with Parkinson's disease and wondering why they don't experience the shaking or trembling that many associate with the condition. Parkinson's disease is known for a variety of motor symptoms, but not everyone with the disease develops tremors. This variation is quite common and reflects the complex nature of the disorder. Parkinson's disease is not the same for everyone. It has different subtypes, which means it can show up in various ways. Some people have a tremor-dominant type, where shaking is the main symptom. Others have an akinetic rigid type, where the main issues are slowness of movement and muscle stiffness. These differences depend on which parts of the brain are affected and how the neural circuits are involved. The brain circuits involved in tremors include areas like the basal ganglia and the thalamus. In some patients, these circuits are less affected or are affected in a way that doesn't produce tremors. Instead, their symptoms might be more about rigidity or slowness because different pathways in the brain are involved. So, the pattern of brain degeneration plays a big role in whether tremors develop or not. Tremors can also appear later in the disease. Some people might not have tremors at first but develop them after years of living with Parkinson's. Others may have a form of the disease that simply doesn't include tremors at all, no matter how long they live with it. The timing and progression of symptoms vary widely from person to person. Medications used to treat Parkinson's, especially those that increase dopamine levels, can sometimes reduce tremors. But not everyone responds the same way. Some patients find that their tremors don't improve much with medication, while others may have little to no tremor because their disease affects different parts of the brain or because their symptoms are managed effectively. Genetics and environmental factors also influence how Parkinson's shows up in each person. Certain genetic differences may make some individuals more likely to develop tremors, while others may not. Environmental exposures, like toxins or lifestyle factors, can also shape the disease's presentation. Although scientists are still studying these influences, they clearly contribute to why symptoms differ so much. In summary, not all Parkinson's patients develop tremors because the disease affects different parts of the brain in different ways. The subtype of Parkinson's, the stage of the disease, individual genetics, and how the brain circuits are impacted all play a part. Understanding these differences helps doctors tailor treatments and set realistic expectations. If you or someone you care about has Parkinson's, it's important to work closely with healthcare professionals who can provide personalized care based on the specific symptoms and disease course. Remember, Parkinson's is a highly individual condition, and each person's experience is unique.